Hello everyone, and welcome to this third and final session of the webinar on MCDA. My name is Henk Broekhuizen, and today we'll talk about some methodological issues to consider when choosing an MCDA method. I prepared this presentation together with Karin Groothuis and Janine van Til, so even though they're not here, they've had some input on the content. And the other two persons you see here are Maarten IJsselman and Marjan Hummel, who are both also part of our group here. So, before I start with my subject, I want to give a very short recap on MCDA as we've discussed so far. So, MCDA is a method to make decisions in a more structured manner. So, the first thing you need for this is a goal. So what do you want to achieve with your decision? So for example, you're deciding to buy a car. What you then do is that you decompose this decision into more measurable criteria. So you think about, okay, what matters for the goal? So for example, for me, if I'm going to buy a car, price is important to me, and maybe fuel consumption as well. What I then identify is the alternatives that I have. So maybe I'll go to a car retailer, or I'll look on the internet and say, okay, what cars can I choose between? And in this example, maybe just car A and car B. And then finally, I make a performance matrix, which means that I'm going to collect evidence that I have about the car. So for example, I know that car B is slightly more economic and car A is cheaper. And now of course, if I'm going to make a decision between these two cars, this matrix in itself doesn't suffice. I need more. For example, I need to know, is fuel consumption, a high fuel consumption, is it good or is it bad? Is a high price good or is a high price bad? And then an even more difficult question is, okay, so what's more important, fuel consumption or price? These two questions will be the subject of this first part of the presentation, which is on preference modeling. So how do we measure what we find important? So I'll give you some background, then we'll work through an example of a weight elicitation, and finally I'll shortly discuss linearity, which was a question that was actually asked after the last session, and unfortunately the last session didn't allow for much more time, but I can shortly discuss it now. The second subject I'm going to address is uncertainty, so imperfect knowledge, things that we don't know. I'm going to show you two approaches to address uncertainty, and I'm going to give some points about why we should care about uncertainty. And I'll finish with a conclusion and give you some tips for further reading. Okay, so the first subject of today is the preference modeling. And before we start with the subject preference, maybe it's good to be clear about what we mean with preference. For this, it's good to make a distinction between evidence, belief, and preference. So, say for example, I'm going to give you an example for this. We have a car and it's speeding along, and what would the evidence be about this? Well, for example, this guy, he has a laser gun, maybe he's with the police, and he says, okay, the speed is 105 kilometers per hour. That's just a fact, an observation. Belief is saying something about a fact whilst not knowing it for sure. So, for example, the blindfolded guy might think that the car is going about 100 kilometers per hour, but he's not sure. Maybe he's heard the noise of the car and says, well, maybe that's the case. And finally, this very unhappy guy might say, oh, that car is way too slow. So if the red guy is going to buy a car, he would probably not buy this car because it's too slow. So what we're going to talk about today is the last example, and I hope not also negatively that cars are way too slow, but it's important to know that preferences are value judgments. They are not right or wrong, and it's not the case that if my preferences are different from yours, that I have better preferences or you have worse preferences, etc. Okay, so with that out of the way, let's go into MCDA. There are two places in the MCDA process where we have preferences. The first is within a criterion, and you use preferences to convert your raw performance, for example, fuel consumption, into some value. And for that you need a direction. So as I said earlier, maybe a lower price is better than a high price, and a lower fuel consumption is better than a high fuel consumption. So we need to know, are the criteria in a way good or are they bad? We also need to know the shape of the preference. Can we say that it's just a single line, or is there maybe some bound, or is there a curve going on? These kinds of issues were dealt with actually in the first session, where Janine had this slide, I think. So for the rest of this session, we're going to focus on another kind of preferences in MCDA, which is preferences between criteria. So the question then is, what is more important to me, price or fuel consumption? Okay. Before we answer that question, or at least go into more detail, let's present you with an example. Okay. Think about this. If you are buying a car, is the price important? Just think a couple of seconds about this. What do you think? One way of looking at it is saying, yes, well, obviously it's very important because these are my options: a very cheap crappy car, which only cost me 500 euros, and a really futuristic cool car that costs 100,000 euros. Obviously, if you're deciding between these two cars, price is going to be a very important factor, because you are going to want to know, what do I get for all this extra money? It's very important. But unfortunately, this is not the whole story. Another way you could look at this is say, well, what if my two options are these two cars, like 100,000 euros blue futuristic car, and another car that only costs me €1 more. If you were presented with this choice, maybe then price wouldn't mean so much to you, because even though the car on the right is cheaper, it's only by €1, so who cares? It's only €1. So that's an important point. Criteria weights are scaling constants, and they depend on the preference model, and also, as I just showed, the range of alternatives that are under consideration. So before you go into all the weight elicitation and all these kinds of things, it's very important to know that a weight is not a weight is not a weight. And those of you who know health economics might get the reference. What I found very informative is a whole chapter actually, in a book by Belton and Stewart in 2002, which deals mainly with these subjects, and then also goes into detail about what weights do mean in some MCDA methods. I'll give you the full reference for the Belton and Stewart book at the end. Okay. What I'm going to do now is give you an example of one method to elicit weights. So this method is called the swing method, and you'll know why it's called the swing method later. But before I go into the details of this method, let's introduce you to our decision problem. Instead of cars, we're now going to look at scanners, for example, for a nuclear medicine department or whatever. And if you're going to buy a scanner, there are a couple of things that might be important to you, like cost, resolution, calibration or radiation load. And I'm not an expert, of course, on scanners, but I imagine that this might be the case. The first thing you're going to do when you apply swing is defining upper and lower bounds for each criterion. So what this means is that for each criterion you're going to say what's the best and what's the worst. And I'll show you what I mean. For cost it's very simple. The cheapest one obviously is the best, and the most expensive one obviously is the worst. We like cheap scanners and we don't like expensive scanners. For spatial resolution, we obviously want a very good resolution, because then we can find, for example, defects in the heart better, or maybe if it's for breast cancer imaging, we are better capable of finding tumors, etc. Temporal resolution, so time resolution, we also like to be low, because if, for example, you're making a cardiac image to, for example, image the perfusion in the heart, then you want to have a good time resolution so you know what is going on. The size on the operating theater room, we like to be small, of course, because otherwise people will trip over it or we won't have enough room, etc. Ease of cleaning, obviously higher is better, not just because of time and money, but also because of risk maybe of infectious disease and stuff like that. Calibration requirements, we like to be as low as possible, and we don't want to spend each day, every day, calibrating our scanner, while in that same time we could scan patients and help them and also make money. And finally, radiation load we obviously want to keep as low as possible as well, for both the patients and also maybe for our staff that are working with the scanner. Okay, now that we've defined this, the swing method makes two scanners, two hypothetical scanners, the absolute worst scanner and the absolute best scanner. The worst scanner, as you see, is really expensive, it has awful resolution, it's really large, it takes a lot of time cleaning, you need to calibrate it every day, and you radiate patients enormously. So this is very bad. The hypothetical best scanner, on the other hand, is really cheap, good resolution, small on the operating theater floor, easy to clean, needs to be calibrated only weekly, and has a low radiation load for the patient. Okay. So the question you're asking now is, given that you have the worst scanner, and you could choose one criterion to change to the best scanner level, what criterion would you choose? So for example, you could say, well, this worst scanner is really bad primarily because there's just very high radiation load, so maybe we can change that to low. Or maybe you say, well, this price is really, really awful, and maybe we should change that to the best scanner level. So this is a very hard question, and of course I'm not in any position to give the right answer or like maybe even a realistic answer, but looking at myself, what I thought was, well, I think radiation load is really important because it's about patient safety, and that's obviously important. So that's the most important. So what I do is that I give radiation load 100 points. So improving the worst scanner with regard to radiation load from high to low is worth 100 points to me. When you've done this and you have a new scanner in a way, so this worst scanner is now improved on the radiation load because I selected that first. The next step is, okay, given that I have this scanner and I can improve another criterion from the worst level to the best level, what would it be? Think about this. For myself, again, I said, well, spatial resolution is about the clearness and the accuracy of your image. And since the goal of a scanner is to find stuff and you need a good resolution for that, I think spatial resolution is important. So if I could improve my spatial resolution by 1 millimeter, as here, that's worth 80 points to me. And you go on like this. So then the next question is, if I've got these two scanners, so the worst scanner, that's improved on spatial resolution and radiation load, and this best scanner, what would I change as a third criterion? And you go through all the criteria like this until the worst scanner, or not actually worst anymore, but until the worst scanner is completely the same as the best scanner. As you've seen, radiation load is most important to me, then spatial resolution, then temporal resolution, then costs, and I think these three things are not that important. And again, I don't know if this is realistic at all, but just to give you an idea. Okay. Since we want weights to be in the range of 0 and 1, and we want them to count up to 1, we just normalize them to get the normalized weights here. So this is a method to calculate weights, and when I talked about weights earlier on, I said that a weight is not a weight is not a weight. So what does a weight actually mean when we apply swing weighting? Well, if you go back to actually maybe the first one, this actually shows it. A weight here is the value that I attach for a scale swing from the worst possible level of a criterion to the best possible criterion, best possible level on the criterion. This is worth 100 points to me, or conversely 30% of my weights. So for example, for the calibration requirements, I thought the worst level was daily, so an improvement from weekly to daily is worth 20 points to me, or normalized 6% of my total weight allocation. So the meaning of a weight is a scale swing. And important to know now is that if we're doing swing weighting, we're assuming linearity. So the complete scale swing is worth the weight to me. So for example, 30%. And anything in between the best and the worst is just given a weight value that's linearly interpolated between the worst and the best level. But then you might say, well, maybe this is not very realistic, and that's one of the questions that came up last time. Do we really need to assume linearity? No, we don't. You just have to ask some more questions. So again, going with the worst, medium, best example, a question you could ask is, what is more important to you? An improvement from worst to medium, or an improvement from medium to best, and how much? And if, for example, you say that an improvement from worst to medium is not so important, but an improvement from medium to best is really important, then you get a curve like this. So the scale swing from worst to best is still the same, so the weight still means the same. But in this case, if you have a medium score, you don't get half of the weight, but about a third, I think. Okay, there are several MCDA methods that allow for the elicitation of non-linearity, and not all methods allow that. And I'm not going to give you a list right now of all the methods that can and that cannot do, because maybe that's a bit too detailistic. But important to know is that most MCDA methods, especially the value measurement methods, can take into account non-linearity, but in general it takes a lot more time, because instead of just comparing the worst and the best level, you also have to compare levels in between, and this is just with 3 levels, but you can imagine that there can be much more in the way of levels. So before you go around starting to model nonlinear preferences, think hard about, first of all, are there criteria that would likely to be nonlinear? Some criteria are more logical to be nonlinear than other criteria. And it's also very important to discuss with the decision makers. What do they think? Do they think that linearity is reasonable to assume, or do they think that there are some criteria that might benefit from having a little bit more detailed look at them? Because you don't want to end up assuming linearity everywhere and then having completely nonsense results that no one accepts, including your decision maker, because then there's no use to your MCDA. Okay, so that's the first part. Let's see if there are any questions yet. I don't see any questions. Maybe if there are questions, now is the time to ask them about preferences. Nope. Okay. Then I'll move on to the second subject of today, which is uncertainty, which is a little bit closer to what I do in my PhD project, so I hope I can tell you some useful stuff about it. Okay, what is uncertainty? We actually did a review about uncertainty in MCDA, and when we started the review, we set out looking at literature, what is uncertainty, and it actually turns out to be pretty hard to capture. There are countless definitions, countless categorizations, so uncertainty, what is meant by uncertainty, is also uncertain in itself. But in the end, we took this categorization, which has normative or methodological uncertainty, which is so uncertainty about normative choices in your model. So mainly, who are your stakeholders? Who gets to determine what the criteria weights are? What MCDA model are you going to use, etc. Structural uncertainty deals with the structure of your model. So, for example, what criteria do I use? Do I have all criteria? Do I have all alternatives, or are there maybe alternatives missing? Is there a time horizon, and if so, what? Etc. These two types of uncertainty have been really nicely described in these two articles. And again, I'll give you the reference at the end. But what we're going to focus on now mainly is these two types of uncertainty, the more numeric types of uncertainty. These two are slightly harder to capture, and they're mainly dealt with by having an informed discussion and having a structured discussion and things like that. And for the third and the fourth, we can have numeric models, and that's what we do. Okay, so I'm going to present you with two approaches. The first one from the review, and the second one that we also find in the review, but that we've also applied ourselves. Okay, let's go back to our example. Let's say we have these three scanners again, and we know the price of scanner B, but we're not so sure. Maybe the manufacturer is unclear about the price, or we don't know for another reason. So what we can do then is apply what we called in the end deterministic sensitivity analysis. So plainly just pulling the numbers and see what happens. So for that I'm going to switch to an Excel that I made. Okay. So in this Excel sheet I made a very simple MCA model of the scanners, and I'll walk you through it with swing weighting, by the way. So the weights here are exactly the same as I showed you in the slides. So radiation load is the most important, spatial and temporal resolution also very important, cost a little bit important, and these three not so important. The performance matrix is here. So as you see, scanner A is the cheapest, scanner C is the most expensive, and scanner B is in between. And the rest follows. What may be good to mention is that the 1, 2, and the 3 here are just categories, where 3 is the best category, 2 is the intermediate category, and 1 is the worst category. And in this case there are even only 2 categories. Using the partial value functions that we discussed, we end up with these partial values. So for example, we said that this price was the best. So in this case scanner A gets all points, so a 1. Scanner C is the worst, so it gets 0 points, and scanner B is in between. And the rest follows. And then the result is that, as you see it here in the graph too, scanner A and C are roughly equal, and scanner B is much more important. So what happens if we're not sure about the price? Well, we can just put in the number. So maybe it's slightly more expensive. Does that mean anything? No, the score is slightly lower, but it's still way higher than C and A, so who cares? If it's 350, what happens? Well, it's still lower, but still not lower than C and A. And you could go and say, well, what happens if it's 500? Still not lower. What's very important to notice now, and I hope some of you might be gasping at the screen already because I'm doing this, by extending this price above this 350 threshold, I'm actually breaking the way in which I determined my weights. So if you remember, this is what it was. This 50 points is the worth that I attach to a swing from 250,000 euros to 350,000 euros. So if I go above one of these bounds, my weights don't mean anything to me, because you could just give insane numbers here, and still scanner B would not be worse than scanner C. Well, in reality, I hope you'll agree with me that a scanner that is this expensive obviously is very poor, especially when compared to the other 2 options. So what we can do instead, maybe, is see if the allocation of our weights is important. So I said, for example, that the spatial and temporal resolutions were important, but temporal resolution was not as important. So what if we say if that's equally important as a spatial resolution? Well, nothing happens. So that's maybe not so important. We can do lots of things to it and nothing happens. So I hope you get the gist of this, which is see what parameters you have, put other numbers in, and just see what happens. And of course, if you would have this conversation with experts, then maybe they would give more realistic things. So for example, they would know with more have more knowledge about realistic values for temporal resolution, or they would know something about what patients think is important, or well, whatever. Okay. Are there questions about this part of the presentation? There's one question. How did you get the overall value? That's a good question. The overall value is the weighted mean of the partial values. So for scanner A, it's 1 times 16%, because that's for cost, plus 0 times 25%, plus 0 times 16%, etc. You can see it here. It's just the weighted sum of these performances. And this actually goes back to what I showed you here. So if you are the best, then you get the full weight for your value. I hope that's more clear now. Okay, yes, good. Okay, well, this is one way of doing it. There are some disadvantages to doing it like this. First of all, I don't know if the range that I'm putting in here is realistic. Is it between 300 and 290? What's the distribution between these ranges? What does it look like? I don't know, so I'm just playing around. That's one disadvantage. And the second disadvantage is that I'm only changing one parameter at a time, even though in reality all the criteria might have uncertainty going on simultaneously. So I'm not just uncertain about the cost, but at the same time also about the spatial resolution, also about the time resolution, also about the radiation load, for example, I don't know, and maybe also about my weight. So that's a lot of parameters that I have to change at the same time, and in this way that's a little bit difficult. But luckily there's another way that we can do uncertainty analysis, and I'll show you that now. Let's see. Okay. The second approach I'm going to show you is more complex, but I think also much more versatile to deal with uncertainty. So whereas in the deterministic approach I just changed values and looked at what happened, what I'm doing here now is taking on a much more formal approach and saying, okay, there are some parameters I don't know for sure. Maybe I can assign a probability distribution to that. So if we do that for all parameters that are uncertain, I can vary those all together and see what happens. Now, as you might have seen in the Excel sheet, there are actually a lot of parameters that have all kinds of interrelations. So you might imagine that if all of these have probability distributions, then the end result or the overall value gets very complicated. So what we often do then is just use Monte Carlo simulations, so repeatedly drawing or sampling from the simple distributions in order to approximate the complex value distribution. And that's actually what we did in the first subject of my PhD thesis. You see the title here below. It's currently in submission for a journal, so hopefully published soon, who knows. So I'm just going to show you a little bit from that article. I'm not going to go in all the details because there's too much, I think, but just to give you an idea. Okay. So what are we seeing here? In the article that I just told you about, we compared 3 antidepressant drugs: duloxetine, venlafaxine, and bupropion. For each of these antidepressants, we have a benefit score. So benefits might be things like the drug working or the drug fighting against a depressive episode, things like that. And risks might be adverse events like being very tired or feeling even more sad and things like that. Now for all of these parameters, we can also assign a probability distribution, as I did before. And what you then get is a probability distribution around the weighted benefits on this side and the weighted risks on this side. So each of these dots is just a single run of the Monte Carlo simulation. So just one value that was sampled from the benefits and one value that was sampled from the risks. The line you see here is where benefits and risks are equal. So if these points would be above the line, then we would have more risks than benefits, and then maybe we don't want the drugs. So in this case, you see all the points are below the line. So we think that they are probably acceptable because they have more benefits than they do risks. So what can you do with this? Well, first of all, of course, you can assess the uncertainty, because you say, well, the mean is also below this line, but with the uncertainty analysis, I can also say, well, the chance that the actual mean is above this line is very, very small. So probably we're safe to accept these drugs. What you can also do is compare these drugs. So if you could only choose one drug, what drug would it be? And I hope that if you look at this graph, you can see that this drug, the light blue drug, is the best. Why? Because it's most to the right, and the right means more benefits. So compared to the other two drugs, the blue drug has more benefits than the two other drugs, while with regard to risk, they are roughly equal. But of course, saying it like this, so I think the blue drug's best, is obviously not very precise. So what we can do is calculate the chance that the blue drug is better than the purple or the yellow drug. And this is what you see here. The curves here are the same as the scatter plots that you saw earlier, but what I want you to focus on now is the most right column. And what you can see here is that this center column, which is the blue drug, has the highest probability of being ranked first. So the green part of this bar means probability that it's the best. So this drug has the highest probability of being the best, while the, I think, what was it? The yellow drug also has some chance to be the best, but not so high. And the last drug has a very low chance to be the best, but a very high chance not to be the best. So what the uncertainty analysis adds in this respect is that if we just have the means here, so if you would only have single points, then the only thing you could say is, well, I think the blue drug is the best, but I'm not sure if that's stable or if that decision, how confident I can be in that decision. Well, if you have this data, you can say, well, I'm pretty sure that the blue drug is the best. Okay. So now we've seen two ways to address uncertainty. We've seen the simple deterministic method, where we just changed values and saw what happened. And we've also seen a more complex probabilistic method that assigns probability distributions to all the parameters. And I'm sure that especially for the latter, I skipped about a lot of details, and maybe it's a little bit unclear now what we've done, but I hope you see the value of adding uncertainty to the MCDA. Because if you are just looking at the mean values, then you might make some mistakes. Okay, and just to drive that point home, I've got some more slides about why maybe uncertainty is important. And there are three ways that uncertainty maybe is important, just to make you think about it. The first reason why I think we should care about uncertainty is what I told you earlier, robustness, meaning how confident can I be that decision that the model recommends is actually the best decision. And as an example, consider this. This graph shows the probability that a particular drug is acceptable, meaning that the benefits are more than the risks, given some parameter, in this case the weight that patients give to adverse events. So here on the right it means that they think adverse events are quite important, while here on the left it seems that the patients don't think that adverse events are so important. And what you see is that the more weight patients attach to adverse events, meaning the more they are averse to the adverse events, so they really don't like the adverse events, then the chance that the drug is acceptable is very low. That makes sense. Well, if in the other case they don't care about the adverse events so much, then they'll just take any drug. They don't care about the adverse events. The two black lines you see here are the confidence interval for the adverse event weight. So even though we don't know where the actual weight or the actual weight distribution is, we do know that with some certainty that it's between 0.16 and 0.27, say. And, not to go into detail, but I hope you see here that the exact or the actual weight that's here matters a lot, because it means that either the drug is horrible and no one wants it, or the drug is terrific and everyone wants it. So if this were my decision, then I would say that with regard to this weight, the decision is not robust, because it's just very sensitive to the exact weight here, and maybe we don't know that much about the weights, and if we don't know that much and we have to make a decision, maybe this is not the time. The second reason that I want to just shortly point at is the flaw of averages. And maybe you know this graph, this picture, which is the statistician that is drowning in a pool that was 3 feet on average, but very deep in the middle and very shallow at the end. So maybe this is a good metaphor for an MCGA that only considers averages. If you only look at averages, maybe you will drown. I hope not, but that's also a reason why you want to consider uncertainty. And finally, uncertainty can help, or taking uncertainty into account, can help you focus research. So just as a very nonsensical example, say you have done an uncertainty analysis and you have some measure of the impact on a decision of parameters A, B, C, and D, and you also know the cost of reducing the uncertainty in each of these points. You can then compare these points and say, well, maybe for example I want to research C more, or maybe I want to research D more, but I don't think there's a right answer to this particular illustration. But if you have this information about uncertainty, you can, first of all, as I said about robustness, say, should we decide now, or is it too uncertain? And if it's too uncertain, you can have a question about, okay, or an answer to the question, if it's uncertain, what should we do next? What parameter should we focus on? Should we have a new clinical trial? Should we ask more patients, or should we research some other things? So uncertainty analysis can be a very useful tool for decision makers to assess the robustness, but also to focus future research if they can. Okay, so I hope you understand now that uncertainty is very important in decision analysis in general, but also in MCDA. Are there any more questions? And I see we're right on time too, so that's good. There's a question that says, how did you determine the parameters for the distributions? And I suspect that's with regard to this. So that's the antidepressant case. What I can do is maybe find a poster, because it was a poster at some conference. Okay, let's hope this works. So this was our source data. I hope this is visible. Okay, good. So we had two kinds of parameters. We had weights, and we used a study with only 12 patients. So we bootstrapped the weights just to get an idea of the distribution. And for the odds ratios, we used a log normal distribution. And that's not mainly based on the data, but a log normal distribution is just good practice to use and commonly used to approximate uncertainty around odds ratios. Does that answer your question? Okay, good. Get rid of the poster. By the way, if someone wants to see that poster or download that poster, I think it's available through the University of Twente website. So if you go to the seminar website, there should be links to our publications, and I think the posters are just free to download. And if they're not, just email me and I can send you the posters. Okay. So I want to finish with some conclusions. During these past couple of sessions, we've seen, but with our experience the past couple of years, we've seen that interest in MCDA is growing, also in healthcare, but there's still considerable variation in practice. To put it bluntly, we don't know what we're doing yet, maybe. So, although many MCDA methods exist, each with their own advantages and disadvantages, there's still not a lot of guidance about how we can actually use all these tools that are available to us. So what I hope you've learned from this webinar, you've learned obviously the basics and hopefully some other things, but obviously we cannot cover either MCDA or our research in just 3 hours. And what we think is needed at this point, if we really want to get structured decision making further, or at least MCDA decision making further in healthcare, there are some points that are important. I think we need to know, and we also need to learn in practice, what MCDA method to use. So what method is maybe easy to use, but also valid from a methodological point of view. We need to really think hard, and that's a question that we as researchers cannot answer, but that should be answered at EMA or at HTA agencies. We should really think hard about whose preferences matter. So do the decision makers get to determine the weights? Do patients get to determine the weights? Do companies get to determine the weights? And if they all do, what are their respective weights? Are patients more important or are decision makers more important? Very difficult questions. But it's questions that we need to answer if we really want to go forward with MCDA. Third point is uncertainty. We cannot ignore uncertainty. If we ignore uncertainty, we're going to drown like the statistician in the average 3 feet pool, and we don't want that. But we need to think hard about what method we can use for this. Will we use a simple method that's easy to implement and will just give us a general idea? Or are we going to use a very complex method? For example, the probabilistic approach method. And actually in the review we even found methods that were more complex than that. Maybe they're really useful and really cool, but what's the actual value for day-to-day decision making? And finally, to help with these other issues, I think visualization is important. For the Excel example that I gave you, I could have just given you some numbers, but I think that I gave you a graph and some colors that really made it more easier to grasp, especially because there were a lot of things going on. Okay. So I hope you agree with my last points, and if you don't, well, speak up or just send me or someone else mentioned here an email. So any other remaining questions, of course, you're welcome to ask them now, or just email one of us later on. Here at the University of Twente, or at least at our department, we're just experimenting with this whole webinar idea. So we don't know if it's good, if it's bad, what you like, what you dislike. So we'll send a survey after the webinar to hear from you what you thought, and if you have points for improvements perhaps, or if you would like another webinar, and maybe about what. Okay, so before we end, I'll just show you the references. Don't go typing like crazy now. I'll show you again the YouTube link, or I'll send the YouTube link to you. My office is breaking down. I'll send you the YouTube link again, so you can also find these references. And if you can't reach them or you need other references, just ask or email me, and we can sort it out. Okay, so right on time, 5 minutes to 6. Thank you all for your attention. If there are any remaining questions that you'd like answered now, you are very welcome to ask them now. And if not, then I wish you all a very good evening. Lou, Björn, Leah, are you still with us? Oh, okay. Oh, okay. Okay, so there's a question. By the way, it's only me and some organizers left, so all the important people are gone. Björn, let me just activate you. Björn?
Yeah, yes.